thank you very much for inviting me along to help with this discussion today. And I'd like to bring to the context of the discussion a little bit more about how practitioners can apply an approach to shared decision making within a clinical setting. What I'd like to do in this session is share the resources with you and talk a little bit about how they might be applied within clinical practice for osteopaths. And I think that's the most important thing. The resources are tools. They are avenues or ways into stimulating and supporting conversations with patients. And they're tools designed to enable patients to have those conversations in their own words so that they're able to think about what's important to them within their care.
Simeon, if you could stand at the lectern, please, that allows you to be able to be seen by the people.
Sorry, and I have a habitual manner of wandering about. Thank you for correcting. So it gives patients a different way of thinking about what's important to them and how they might communicate back with their practitioner when they enter a clinical care context. It's often quite intimidating and off-putting, and it may be difficult to assimilate and understand all the information that is discussed in a clinical encounter. And so using tools such as those that have been developed by the General Osteopathic Council gives patients a way of thinking about what they would like to talk about and a way of recording that so that they can use that as a prompt within the clinical setting. So I'll show you those in a moment. And I'd also like to reflect on the skills needed to use the shared decision-making resources effectively and how they play into what we do as clinicians. As an osteopath, I have the luxury of time with caring for my patients, and that does facilitate a lot more discussion. But it's a nuanced process, and some patients may not need as much extensive conversation, whereas others, that might be what they need fundamentally throughout the whole process. So we'll talk about some of those skills and the language that we use as a means of facilitating effective conversation and discussion. So much of the first two slides has already been covered, so I won't spend a lot of time talking about at these points. But in the context of the regulator, the primary the goals in relationship to patients are obviously patient safety. We want to make sure that patients are cared for effectively and safely, and that we limit the number of, or we avoid practitioners running into difficulties in relationship to patient care. So the context of protecting the public is very much embedded within what the regulator does. And a way of doing that is, rather than seeing regulation as a top-down process of imposing rules, a more effective way, which Fiona alluded to earlier, is thinking about how we might think about upstream regulation, if you like. So thinking about how we enable and support practitioners to minimize potential risks, enabling them to practice in a way that is safer and potentially more effective for their patients in practice. And the resources that have been developed offer some tools that, again, can enable practitioners to take those steps so that effective communication is embodied at the start and that patients feel very much part of the decision-making process. The vast majority of complaints that are heard by regulators in general often come down to communication, often misunderstandings between patient or practitioner about what's happening and why it's happening. So these tools are another element of how we go about trying to minimize risk of harm, but also, more importantly, to optimize the care process so that patients feel as if they are and are in fact making decisions that are important to them. In the context of the standards, shared decision making bridges all four of the osteopathic practice standards. If you're interested, there are copies of the osteopathic practice standards on the table in front of you, but in summary, there are four key themes: communication and patient partnership, knowledge, skills and performance, safety and quality in practice, and professionalism. And the art of good communication is embodied within each one of these standards. So being an effective communicator, and by being able to communicate well with patients and listen effectively to patients and act in collaboration and in combination with patients, underpins all four of these standards. And therefore, by embodying the sort of approach to shared decision making as practitioners, we are working effectively within those standards of care. And I wanted to place the process, I'm wandering off again. I wanted to place the context of shared decision making within the way in which we make decisions in clinical practice. So again, touched on earlier, evidence-based practice is a fundamental framework that's commonly used within healthcare and is often used by osteopaths in clinical practice. And as was emphasized by Fiona, it's a marriage of three domains. That of research evidence, which is very important. It's critical that as healthcare practitioners, we understand best practice, good practice. We have an understanding of guidelines that's developed through the knowledge and research that has evolved within healthcare. But of course, research it's a window into understanding things. It doesn't give us everything. It doesn't help us it helps us to make clinical decisions, but it doesn't give us all the answers. Clinical experience also helps us translate research into practice by helping us relate to the contextual significance of how we make decisions, and through our practice, what seems to work well in certain situations. And occasionally, quite often those things overlap, and sometimes they may be different. The clinician is making care decisions based on their understanding of good evidence, where evidence is lacking, clinical experience, but also, and most importantly in the context of what we're talking about today, the patient's preference. So we've talked about these issues in relationship to the conversations about hip surgery and being able to make informed decisions. And shared decision making, it draws upon the patient's preference to help the clinician translate and make sense of research evidence and their clinical experience, so that in the middle of the Venn diagram, the best decisions for the patient are made. And that's where we want to try and embed practice. It's not always possible, I suspect, to be thoroughly embedded in that zone. But through shared decision making, we can give a voice to the patient and understand their preferences in care so that we are making decisions in their best interests. Another approach to practice considers the biopsychosocial model. BPS stands for biopsychosocial, and fundamentally, again, breaks down into three easy to digest domains. The biological, the physical, the physiological elements of illness sit within this domain, and understanding those is the role of the clinician, and being able to translate those is the role of the clinician. But the context within which these problems evolve, the social and psychological elements of the patient's world, how illness affects their mental health, how it influences or isolates them within their community or within their family, or disempowers them, takes them away from being able to interact with friends and social groups, is just as important in how we choose and act to care for people. And patient choice and patient's goals and patient's needs dwell in those two domains. It may be okay if, you know, they rely on the clinician and their expertise of the clinician to translate and understand what might be going on. But the clinician's role with the patient is to then decide how best to support them to return back to the activities that they value and cherish. So patient values fundamentally underpin the biopsychosocial model and play a massive role in how we should be choosing to act. So there are a number of resources that have been developed, and one of them is this useful video. Now, I'm going to play this video and then we'll just touch on it a little bit. You might have some points to raise at the end of the presentation. So I'm going to hopefully play this. I'm reassured that it will work, and it should be loud enough. If you can't hear, let me know and we can play it a different way, okay?
If you're thinking about visiting an osteopath or have already booked an appointment to see one, there are some things that you might like to consider in advance. Your osteopath will want to ask some questions about you. Not only about any symptoms that you may be experiencing and your general health, past and present, but also about you as a person. It's important that your osteopath understands your needs fully, so together you can develop a suitable treatment plan. Think about what matters or is important to you, and how any current symptoms might be impacting on this. Maybe you're unable to participate in your usual sport, or play with your children or grandchildren as you normally would. Perhaps you want to get back to gardening as quickly as possible. Maybe your work is being affected, or you have a family event approaching that you don't want to miss. Consider also what your expectations of osteopathic treatment are. If you've never been to an osteopath before, do you want the osteopath to talk you through how it works, or what it can and can't achieve? If you have visited an osteopath before, what did you like about the treatment that you received at that time? Could anything have been done differently? Remember that the osteopath is working together with you. So don't be afraid to say how you feel, raise any concerns, or offer feedback on your preferences. Finally, do you have any broader goals for the future? Maybe you want to get fitter, improve your posture, lose weight, or give up smoking. Talking about what's important to you will help your osteopath to ensure that your needs and expectations are met, and to provide you with the best possible patient experience.
Okay, so hopefully, I should have said at the start, the resources that have been developed were very much developed with patients involved in their development. And the feedback that was obtained through the development process fundamentally influenced how we used the language within that video and the terminology that's within the other resources that you have in your packs in front of you. And we'll touch on those in a moment. And I think hopefully you'll see that the language is accessible and makes sense and as facilitatory. The video talks a lot about needs and wants and expectations, and it's about encouraging patients to find their voice within the clinical setting. And I think that's really important. How might you use this? Well, I've used it by embedding it in my website as a resource for patients. And I send out an email to all our patients prior to coming. And within that email is a link to that video on our website, or I think it's to our website, so that patients, if they want to, can choose to watch that video if they've never been to see an osteopath before. Many patients will have been, and they will know what to expect, and they have their voice, and they don't feel the need to perhaps view those sorts of things. But for many, it's an intimidating and frightening process at the start, and they may have find those sorts of resources particularly useful as a means of empowering them to speak and share. Other resources that have been developed include an information leaflet and poster, which can be used in a clinical setting. So these may be used on walls in practices or in the waiting area if you have one. They can be shared through social media accounts and shared with patients prior to their appointments. And again, the idea behind these information posters is to give prompts to patients, offer them suggestions or things they may not have perhaps consciously brought to mind about what they're expecting, and things that they can ask their practitioner in the same way that the video put those points forward. So what's important to me in that point too, what's important to me and what are my goals? It's very important for the clinician as practitioner to be able to understand what somebody's objectives are for care. It's all very well thinking, well, I'll remove your pain or enable you to bend to 90 degrees at the waist, but that may not be particularly valued by the patient. What may be more valued, as was said in the video, are things like being able to walk to the shops or get a restorative night's sleep or feel comfortable lifting their children. And it's those sorts of goals that become directly relevant in thinking about how we measure and judge outcomes together with patients. So having a shared vision about what is an accessible and appropriate goal is really important in judging how effective we are in the care that we provide. So that's one resource. Another resource that's been developed is this document called the patient history. And I particularly like this element, and you'll find these in your packs, and you can find these on the GOsC website. What this does, again, is it frames a clinical encounter to some extent, but it provides an opportunity for the patient to write down what their hopes and aspirations and expectations are. It allows them to record some of their case history. So what's wrong? How does it affect your life? A little bit about their medical background. What medications are you taking? So patients can come pre-armed, as it were, pre-prepared, and they know that they will be able to give you the information that's important to them. And as a good clinician, we will of course be asking, further questions and clarification to ensure that we have a full picture. It can also act as a foil for the practitioner to refer to. So rather than just being given in advance of appointments, it could be used within an appointment as a framework for asking particular questions. And you don't have to use it as a document, but there's a question here that might be relevant to you. You might want a few minutes to think about that. And if you'd like, I can step out of the room whilst you write things down, and then we can talk about them after you've done that. So given the time that's available to some extent in clinical practice, it can be used in a way that's far more adaptive and therefore personal to the patient, and therefore hopefully more effective for the patient in terms of shared decision making. So have a look at that in your packs. And the next step on from that, which is another useful tool, is the patient goal planner. Now, again, not every patient has specific goals. Some people might want to come in and just feel a bit looser or have some relief of pain, and it may not require setting goals explicitly. But particularly for those patients who are feeling particularly isolated or disempowered or significantly affected by their healthcare problems, or they may have long-term healthcare conditions, establishing goals that are valued by the patient, and also the goals that are perhaps achievable within the context of what's wrong with the patient. So bringing your clinical experience to bear and the evidence and research to better understand what might be a good outcome given the situation the patient might find themselves in. This goal planner is another way of thinking about how the patient can relate to their goals and how they can begin to record or measure progress against these goals over time. So if you look at the form, you'll see there are a number of boxes within which patients might, in their own words, write about what their goals are in discussion and conversation with you as the clinician. And then from home, they can take those away and write down how they're feeling on particular days or during particular activities, so that when they come back to see you as a clinician, you can review these things with them and have a conversation about whether or not that's what that might mean in the context of their problem. Osteopaths, clinical practitioners will often use goals as a measure of outcome. So we might use patient-reported outcome measures that may vary from simple pain scores through to more elaborate questionnaires that we might use in clinical settings. They are very much clinically based, and they play a role in this process and discussion, but they may not be tangibly accessible to the patient in the context of shared decision making and patient decision making. So the goal planner becomes a personal chart of progress, hopefully, and then again a useful tool for conversations in clinical practice. What other approaches are there from a clinician's perspective? Well, I think what's very important is being clear about patient expectations. And in my practice, I do try and stop partway through my case history and have a conversation about what patients would expect from their care. What are their fears or worries about care, about osteopathic care? What are they expecting from the encounter, so that I have time for discussions with patients to clarify and make clear what will happen with them. And I've had patients in the past who I've got to this stage in the process, and we've discussed options, and we've discussed their problem, and we've discussed potential alternatives to treatment. And occasionally patients will say, well, I'd like to think about it. And they might then choose to go away and come back again later once they've had a chance to digest what I've told them, perhaps looked at information I might have shared with them or accessed online, so that they have space and time to decide what's best for them. It's also very helpful to explore what patients think is wrong with them. Now, there's particularly in osteopathy, there are quite a few jargonistic terms that float about, and I've put a bone out of place, or that the people use terms that perhaps aren't necessarily medically correct, but are meaningful to them in the context of their care. And it's helpful for me as a clinician to be able to perhaps translate that into what that might mean physically for them in language that they understand, but also to potentially demystify. So patients, I've often had patients who, once I've had conversations with them, say, gosh, I was told I'd be in a wheelchair. And you've heard that story before, but it's true. Patients often come and say, oh, I was told that in 5 years' time with my back pain, I wouldn't be able to walk again or play sport. And for me, that was everything I wanted to do. So sometimes we can identify significant barriers to patients that they may, fears and apprehensions that they may not have verbalized, but we can then begin to talk about and address and help them understand or translate those things into something a little bit more understandable, and potentially take away that fear and take away those barriers to enable them to improve. Reviewing treatment options. So we've talked about benefits, we've talked about brand benefits, risks, alternatives than doing nothing at all. That's a useful conversation to have, and it again offers up patients a chance to make a choice. And it is about patient choice fundamentally. Perhaps practice used to be very much a patrician-based process where we would do to patients. Patients are passive, practitioners are active. I have all the responsibility. You just relax and I'll do everything that needs to be done. We know in the context of healthcare that rarely is that true, and it's important that there needs to be that dialogue, and patients need to be actively involved in their care, both through changing lifestyle or altering lifestyle habits, exercising and taking responsibility perhaps for different aspects that they're able to and that the practitioner isn't able to get the best outcome of care. So reviewing treatment options, giving a patient a choice of action through the consultation. We could do this, we could do that, we could do something different. What would you like to do at this stage? Reviewing management options, and again touching upon facilitating patients to help themselves, whether that be through advice, guidance, through guided exercise. Patients become incredibly empowered when they're given a chance to know that, you know, the treatment in a treatment room might be 30 minutes, but I can go home and treat myself for the next week and make a significant difference to how I feel, and come back to you further down the line of change than when I left you before. And that's a very empowering process, and we facilitate that through exercise software, and we do one-on-one Pilates sessions and various things like that in practice to motivate and support and empower. You can use the word empower then. So, enable is probably a better word. Patients to feel confident that they can do these things and feel more confident in doing so. And lastly, PROMs, and PROMs is patient-reported outcome measures that relates to. There are a number of ways in which we can record outcome measures. There are formal processes that some osteopaths use in practice to report back to a central database to gather data about effectiveness of practice. But other ways and means in which we can help patients measure their progress, and often they can be self-directed by the patient. So they can choose what they feel is important, as I said, when setting goals. And so that when you relate back to change, you can say, well, you know, before you said you could only walk 50 yards before you had to sit down because of your back pain, you're now finding you're walking 150 yards. So that's a good measure of change. It's small in the context of distance for the average person, but for the patient, that's a threefold improvement, and therefore that's highly relevant. And that might be perhaps all that they can access, but it's still an achievement and a goal that may indicate my role as a clinician has been successful. So the tools that have been developed also include a couple of other things which I haven't included in these slides. So look in your resource packs. There's a reflection document which is very useful for clinicians, particularly when we experience critical incidents in practice where care perhaps hasn't worked very well, or patients have come across roadblocks or barriers to care. And we might want to think about how we might change our practice. And whilst there are lots of ways of reflecting, and many practitioners already use reflective practice as a tool in their clinics and within their CPD program packages, these reflective tools, again, just act as a handy sounding board or touchstone for people to begin to center their practice and think about what they're doing and improve as clinicians for the betterment of patients and to enhance the patient voice in their care.